With abortion rights remaining under threat in the United States, there's fears that progress made here at home could be rolled back. When Alice had an abortion at a clinic in Edinburgh, it required 2 in-person appointments. But during the pandemic, telemedical abortions were introduced, meaning women could be sent medication by post after a virtual consultation, something Alice says she would have liked access to.
At the time that I got an abortion, I was working in retail, and so I had to take 2 days off my shift to go to the first appointment. And for a lot of people that might not be a big deal, but for someone who's maybe some people aren't getting sick pay or they work full time, they need childcare. Just kind of minimising the amount of time they have to put into this procedure, I think, is really important.
A new study of women who'd had a telemedical abortion said it was private, convenient and removed the perceived stigma of attending a clinic like this one. The service is still available in Scotland, but there's fears if it's not made permanent, access to it could be limited. Campaigners want the Scottish Government to follow England and Wales in making the service permanent in law.
It's been a long, long time coming. And I think the fact that still nearly, more than 2 years later, we're still waiting for this decision is intensely frustrating, both for women, for providers, and for just, women's rights more generally.
But there are groups calling for the entire service to be scrapped and abortion access reconsidered.
The calls to extend this policy, I would say, disregard the experiences of women and disregard the well-being of women. So this is it's a reckless policy which leaves women to suffer the effects of abortion at home.
The Scottish Government says it's reviewing its options and will provide an update in the autumn. But for women like Alice, she hopes it can give others the access she never had. Laura Alderman, STV News.